Howdy. So if you can pick up your breakfast and sit down, we're about to get started. So welcome. My name's Nick Duffield, and I'm director of the Institute of Data Science. I'm joining you here with Mary Campbell, director of the Texas Research Data Center, to welcome Dr. Robert Santos, director of the U.S. Census Bureau, and welcome you in this room and online to this event. We're very happy that Dr. Santos can join us here on his tour of Texas and today's program of meetings with students, faculty, and the broader community. We're hoping that Dr. Santos can inspire us to think about how census data can be used to communicate and inform policy and decision-making by people and organizations, and how our research here can contribute. Mary and I are grateful for the support of other Texas A&M organizations in hosting Dr. Santos's visit. The Center for Geospatial Sciences, Applications and Technology, the Public Policy Research Institute, the Department of Landscape Architecture and Urban Planning, the Department of Economics, and the Department of Sociology. So now I'm going to hand over to Dr. Mary Campbell, who will introduce Dr. Santos. Thank you.
Good morning. Welcome, everyone. I'm so happy to see you all here this morning. And for those of you online, thanks for joining us. I'm Mary Campbell. I'm the director of the Texas Federal Statistical Research Data Center. That's a mouthful, so we just call it an RDC. And just so you know, A&M has one of only 33 RDCs around the country. This means that A&M already has a formal agreement with the Census Bureau to host a secure lab here on campus for access to restricted data. I tell you this because if you are interested in the census data that you're going to hear more about today, if you're inspired to want to do some research projects, talk to me, talk to the wonderful Dr. Karen Johnson, who is standing in the back there, who runs the lab, or talk to the wonderful Dr. Shannon Degenhart, who I don't see, who I think maybe just read out, who basically created this whole event for us and got everything coordinated. We are always happy to help connect people with data. That's what we live for. It is my great honor to try to strengthen that relationship today. This is Dr. Shannon Degenhart in the back. So if you want to talk about data, that's your third option for who to talk to. It's my great honor to introduce Director Robert Santos in the spirit of building that relationship with the Census Bureau. Director Santos is the 26th director of the U.S. Census Bureau, who was sworn in 2022. He is a native Texan, born and raised in San Antonio, Texas. His career spans more than 40 years in survey research, statistical design and analysis, and executive level management. Before coming to the Census Bureau, he spent 15 years as vice president and chief methodologist at the Urban Institute, directing its statistical methods group. And he also served as an executive vice president at NewStats. He's held leadership positions in several of the top survey research organizations in the United States, including the University of Chicago's National Opinion Research Center. He's worked at the University of Michigan Institute for Social Research and at Temple University's Institute for Survey Research as a senior study director. So his career has made him a specialist in quantitative and qualitative research design, including program evaluation, needs assessments, survey methodology, and survey operations. His expertise is in demographic and administrative data, decennial censuses, social policy research, and equity issues in research as well. Director Santos has received way too many awards for me to talk about today, because then we wouldn't get to talk. We wouldn't get to hear from him. But a few recent ones that you might want to know about include the 2021 American Association for Public Opinion Research Award for Exceptionally Distinguished Achievement. And in 2023, he received the Mexican American Legal Defense and Education Fund's Excellence in Community Service Award. Please join me in welcoming to Texas A&M, Director Santos.
Good morning, everyone. How are we doing? I'm really excited to be here. Thank you, Texas A&M. Thank you, President Welch, and everyone who helped make this happen. We have a great set of partners in different aspects of Texas A&M, including our federal statistical research data centers. And we employ some of the faculty as well as consultants on expert types of advice. But I just wanted to tell you how much I appreciate being here. Thank you. And now for something really different. Okay, I got your attention. So, I'm a native Texan, so I just wanted to tell you how fulfilling and valuable it is for me, born and raised in San Antonio in the barrios around Woodlawn Lake, for anyone who knows San Antonio, to be here and behold Texas A&M. But you know a little bit about me already. I just wanted to know a little bit about you. I'm a survey researcher, so I want to do my thing. So how many native Texans are there here? Any? Yes. Okay. And how many folks are students? Okay, that's good. We need students. And so the faculty, how many faculty and staff? Oh, nice mix. We have a nice diversity. And did you notice they're all sprinkled out? So there's no clustering. Clustering can be inefficient. And clustering, in survey sampling, you draw you'll draw counties across the nation. And then within the counties, you'll draw some blocks. And then within the blocks, you'll draw some housing units. And then you send interviewers there, right? Back in the old days when we did in-person interviewing. And that was really inefficient because the people in a block tend to be like each other, like neighborhoods or the, lower income class, middle class, high, type of thing, race, ethnicity mix and such. And that can be inefficient. And what we find is that that's because something called the intra-class correlation. Then to the extent that people are related within these clusters, it reduces the efficiency, the statistical efficiency of your sample estimates after you do your survey. And so what you like to do is you like to draw clusters that are heterogeneous, that are people are very different from each other. And in fact, you could actually, as a sampling statistician with the art of statistics and the art of sampling, you can actually physically create diverse clusters so that there's negative correlation, in which case you're actually doing better than just random sampling the population. Now, there's a lesson in here, folks. So I talked about survey sampling. I talked about statistical efficiency. It's all about knowledge gain. And today I'm going to talk a little bit about the same principle, but from the process of critical thinking and creating better data and more relevant data for us, for society. So that's why I'm here. I'm here to talk to both the faculty, the students, even the staff, because the principles that I'm going to talk about are those that can help, regardless of whether you're in a hard science or you're in the social sciences or you're in administration or contracts or HR, whatever. They can help you. But first, I wanted to let you know that Texas A&M, actually, we have some experience. So I'm going to tell you a quick little story, and it involves a friend, Val Johnson, I don't think he's here today, right? No. Oh, good. I can talk about him. This is really cool. So he was dean of I think arts and sciences, right? And this was back in 2019, I think, way before I became director. And so at that point, I had been elected to be president of the American Statistical Association. And the weird thing is you get elected in May, but you don't start until the following January. And you start as a president-elect, and then you do president, then past president. So there's that gap. And in that gap is the joint statistical meeting. So like I was all like, oh man, I can't believe it. I got elected president. And I went to the JSN and, we went to the receptions. There was like this reception for the ASA leaders. So I went over there with my wife and, we had some drinks and stuff. And then we said, okay, it's time to go. So I grabbed the long neck and then we headed out towards, towards the next place we were going to go. And I looked and there it said Texas A&M reunion, like, different universities, they bring their students together with the professors and they hang out. I said, hey, Dell, let's go, let's go hang out with those guys. Texas, we're from Texas. Come on, that's enough. So, so we waltz in there. As soon as we waltz in, it's like, in the old West, you're at the bar, somebody walks in and everybody turns around. And they kind of said, you ain't from around here, are you? Like, are you from Texas A&M? And Val walks up to me and he says, like, basically very kindly, he said, well, who are you and why are you here? Because they had, free drinks and food and stuff. And I said, hey, we came here and, we just wanted to see fellow Texans because, I need to go out and start meeting people because I got elected to be president of the American Statistical Association. I have been a big, long, ponytail there with Dell. And they were like, nah. He didn't throw me out, but they were like, sure. And so I talked to a few students and stuff. We stayed about 10 minutes. It was all good. So fast forward, and then my friend Kirby had an evaluation of a center or something coming up. And so I came back like a year later and I told Kirby, invite Val. And so we ended up at dinner together and we had just a great time talking about old times. And I kept ribbing him about, hey, man, you tried to kick me out of this. But it was really cool. But the real thing, TAMU, should I say TAMU or Texas A&M? Texas A&M. Texas A&M has actually played a role in me being here today because in 1970, when I was at Holy Cross High School, I was a sophomore. AT&T had some special seminar or thing on a Saturday at Texas A&M. And so at Holy Cross, we only had a few hundred students, and they took, 10 or 15 of us, put us in a little school bus, and we hauled out all the way here to College Station. And there proceeded to be all these presentations, mostly by students, showing us the wonders of science. So I remember distinctly going into, it must have been physics or chemistry or something, and they had some liquid nitrogen, and they said, watch this. And they got a banana and they stuck it in, and then they throw it down and it shattered. They had a hologram, and they talked to us and tried to inspire us to seek STEM jobs, science, technology, engineering, etc. And it worked. So in a real sense, I'm here today because of you, because of Texas A&M. So thank you very much. And I'll just wanted to share that story with you. Okay, so let's get down to business. I talked about the value of diverse perspectives, I think, heterogeneity and such. And it really has to do with different perspectives adding to critical thinking, which spurs and motivates innovation, creativity, and you get some knowledge gain. And I'm going to tell you a story about that and how it happened to me as a statistician. I wasn't born, thinking this way. It took, 40 years to get there. And along the way, I'd get a little bit more insight and a little bit more just through my experiences. And I do a lot of self-reflection and stuff. And I found that it was really important to bring my whole self to the table, to use everything about me, my life experience, my culture, my values, and my technical training as a statistician in terms of serving on a project team and doing research, working with people, team management, project management, all that. It's really, really valuable. And so I have a story to sort of give you a flavor of how that emerged in me. And it has to do with the mid-1990s. So I was on a study section for the Agency for Health Research and Quality, AHRQ. And, we would come out, 2 or 3 times a year, get applications. There were like 20 or 30 of us. We'd all get assigned a few as primary, and then everybody could, we're supposed to at least glance over them and then interject. And there was this one session that was profound. So this was at a time, mid-90s. Do you guys remember it was before Affordable Care Act? So all of these people in the country didn't have health insurance, and they would wait until they got really sick and then present at ERs, and then the ERs were responsible and did the right thing. They treated them, etc. But the health industry was taking a hit, and yet people still needed health care, and so there was an individual who put in this really interesting looking proposal that had to do with treating chronic pain. And he said, I have the solution. What we can do is we can create an alternative therapy for people who don't have health insurance. And here's my research designed to show the value proposition of that idea. And it was going to be a true experimental design. People would be coming into, health clinics or ERs and things of that sort. And if they didn't have health insurance, half would go to, sort of the usual treatment group where the financial hit is made by the ERs. And the other half wouldn't be. They'd go through this alternative therapy. And presumably, if they could show that there was some effective treatment, it would be a win-win situation, less reduced cost and some therapy. So everybody loved it. I mean, it had a spectacular research design, really crisp research question, really good motivating lit review, underlying conceptual frameworks was fine. The design was great. Sample size was good. They knew their power calculations. And so it was time to vote, and because people said, this is going to solve a problem. Do folks think that's a good idea? Any show of hands? This is called non-response in surveys, folks. Recalcitrance. Okay, do I need to offer something? I can't get up my wallet now. We have some incentives. Okay, anybody? Last chance. Think it's a good idea? Okay, we have a couple. That's good. That's great. So when I was listening to all these people, and I was thinking to myself, wait, there's something else going on here. And I've always been shy, but put me in a structured setting and I can go crazy now. But that took 40 years. But I was really shy back then, and I said, okay, I need to do this. And so, I left out something. I was a master's level statistician. Everybody else there were these rich and famous MD physicians, spectacular, folks, long careers, etc. They were like, scholars, true. And I was just this punky, statistician. I guess they needed somebody to verify the power calculations or something. That was my role. So I raised my hand and I said, and they looked at me like, what's this guy? This ain't about statistical power. They said, okay, well, do you have something to say? And I said, yes. I said, from my perspective, this project cannot be funded or should not be funded as written. And they said, what? It's spectacular. Everybody likes it. What's wrong with you, kid? And I said, well, look, I said, if we do it the way it's designed for people without health insurance, we have to understand that we're creating a two-tier health system. You have health insurance? Step over to door number 1. We're going to give you the best meds, best docs, best this, best that. Oh, you don't have health insurance? Step over to door number 2, and we're going to help you think through your pain. I said, no. I said, if this is a good therapy, it needs to be open to everyone. not just people without health insurance. I know, and I said, I know a lot of people who don't have health insurance and they don't like taking meds. So why not open it up? But if we fund it this way, and it was overwhelming, everybody wanted to fund it this way, you and we are contributing to a two-tier health system. And it was the first time in my career that people actually listened to me as a human being, a statistician human being, but a human being, because I brought my values, I brought my culture, I brought my life experiences. I have abuelitas, I have grandparents, and I have tias and tios. I didn't want them being shuffled off to some alternative therapy. They deserve the same healthcare as everybody else. And that's true now, today. So that's a story of how you can use your whole self. And even if you're not, even if it's an issue that transcends your particular area of expertise, the value of that diverse perspective increases insights and awareness of what we're trying to do. And there's lots of examples like that. So I invite you to think about your own life experiences and your own culture and your own values, because that's going to end up taking you to a new level of critical thinking and excellence that you otherwise wouldn't be involved in my humble opinion. So tap those inner strengths, and then let me tell you another story. Ta-da! Okay, this story is going to be about the use of values, ethics. And it was either going to be my Brazil story, which is kind of cool, but there's a more, to me, important one, because it involves IRBs. I hope I'm not going to go into dangerous territory here. In 2003 or so, I was involved in a reentry project with Urban Institute, but I had a private company in Austin, Texas. And what we did is we would go to the state's prisons and some jails. And I went to Huntsville and for the men, Gatesville for the women, went to Harris County Jail. And we would be let in, the warden would let us in, and we would then interview, it was at self-administration, a group of incarcerated folks who were about to be released within the next week or so. And then we would follow them up after they got out, a week or two later, to look at issues of recidivism. Were they able to get a job? Did they go back to school? Or did they hit harder times or re-enter the system? And my wife, who I worked with me, we had this company. She got a call one day from the Harris County Police, and she said that they told her that an individual had her card that she would give out, like, let's stay in touch because we're going to interview in 6 months. And they said this person was homeless in Houston, living under the freeway bridges type of thing. And there was a storm and he was out, and it was either a tree or a telephone pole fell and killed him. And you're the only contact he had. And we want to know, are you next of kin? And she said, no, I don't. And he said, well, we're going to have to, put him in a group grave and stuff. So we just wanted to try. And she said, okay, fine. Let me see what I can do. She went back to the interviews, and back in those days, we really wanted to make sure we had contact information for everybody. So we got a bunch of contacts for this person. She looked him up and she found a family member listed. She made a decision to go against the IRB protocol and call up the family member and tell them about the deceased. They were so grateful. They had been looking for their brother for years, but he had vanished. And it was just such a humbling experience to help out a family in their time of grief, to bring closure to that. But we explicitly had to break IRB protocol. And we said, it's worth the risk. We're going to do it because it's the right thing to do. So that's an instance where we used our values. And, people may here agree or disagree with it, and that's okay. Part of what I'm trying to do is to get you to think and to dig deep down into your own value system and say, what would you do? So think about it. What would you do? So think about it. Okay. Now that we've done all this and we are good researchers, how many folks are researchers? My non-response has gone away. Thank you. Yeah, this is great. What did I do? Okay. I need to learn from that. A lot of what I did over the last 40 years had to do with developing programs, programs in food, hunger, combat hunger, employment programs, education programs, et cetera, et cetera. And there was this thing that happened that really flipped my vision on research and how one should approach the development of programs to help people. And it had to do, interestingly enough, with a little newsletter. So it was an NIH newsletter. This was, again, back in the 90s, mid-90s. And I was going through and perusing, and, every once in a while in these newsletters, they say, well, here's a project that we funded, and here's the results. And I saw something else, and I went, bam, this is amazing. So it was a project on health clinics, and it basically looked at Hispanics or Latinos who were Spanish speaking presenting to clinics for care. And it showed with a comparative design that Spanish speakers who went to a clinic where some of the staff, even if it was the administrator or the clerk, but if some of the staff knew even a little bit of Spanish, then the health outcomes of those Spanish-speaking patients were better than presenting to a clinic where nobody spoke Spanish. It was English only. Now, this was back in the day of English only, when there was actually federal legislation being debated on that stuff. So I looked at that, and you know what I did? I burst out laughing. And the reason I burst out laughing is I thought to myself, do you really need a research project to show that if people understand instructions, they do better? Come on. But then it hit me like, bam, I had an epiphany. It absolutely hit me. This was the first time I'd ever seen a research project funded by the federal government where it showed the institution, this time the healthcare industry institution, acculturating to a more diverse society. That was profound. It was a big deal. And if you take it a step further, using my whole self type of thing, you come to realize that, we go and we develop all these programs to help communities, to help kids, to help this and that. And what is the approach we take? We, myself included, in our privileged world, say, hey, those are the people with problems. Here's what we can do to help them. And they, do this without realizing that their outcomes, what's happening to these individuals who are underserved or have misfortunes, their outcome is necessarily the outcome from an interaction between a healthcare system and a patient presenting. or health insurance company and, somebody trying to get reimbursed. So it's these interactions between institutions and individuals that lead to the outcome. And what that suggests is that sometimes maybe we're looking only at one part of a two-part in a game here, that we really need to look for treatments, so to speak, and programs for the institutions too, because it's the interaction that always, not always, but often contributes to the outcome. So that's another example of how one can just like flip a paradigm, use your whole experience, and think creatively. So that's my message to you. And what I say is that use your critical thinking. Your critical thinking can be catalyzed. It can be supercharged by adding whatever technical expertise you have in whatever discipline you have, adding your culture, your values, your life experience, and your technical training. And when you put that together, you will have unique perspectives, ideas, and insights that nobody else can have because they're based on your combination of all those things. And the thing that's missing then is different perspectives. You gotta then, it's not enough for n equals 1, but you also need to add other perspectives to generate these insights and this innovation and creativity. That's a message that I'm promoting to the Census Bureau. I speak that every day. I go across from everything from joint statistical meeting, presidential addresses, to talking to students and faculties in my native beloved Texas, to, hey, this is a secret. The secret's out. Let's do it. Let's come together and think differently. So I highly encourage you to try it out. Take a chance. Be vulnerable. You'll be surprised at your own professional and personal development. But I wouldn't be I wouldn't be here unless I talked a little bit about census data. And we have an amazing petabytes of census data to offer. We even have a federal statistical research data center here where you can access confidential information as far as the results go, not the microdata, but you can access it. So a couple of things I wanted to point out. If you didn't already know, our American Community Survey is an absolute treasure trove. It offers socioeconomic, demographic, and housing data on a whole variety of issues, and where nowadays, in our realization that life is all interconnected, we need to know about employment alongside poverty, education, disabilities, housing, etc. And it offers all of those in spades. So take a look at that. It's 3.5 million households a year. And then we take 5 years, then we have individual annual data sets, and then we take 5 years, mush them together, and give you highly accurate data, and data then that can be decomposed down to the census tract and the census block group and blocks even. So take a look at that. We have special tabulations. We're moving forward towards creating new data products. We recently released a detailed demographic and housing characteristics file A, which has an enormous depth of detail on who we are as a nation in terms of disaggregated race and ethnicities. We have over 300 individual race and ethnicities and combinations of therefore, and we have about 1,200 individual American Indian and Alaska Native tribes. It's a really amazing data set, and it reports numbers as low as 5 or 10, something really low at the national level. And then depending on the size of the population, you can dive down into state, county, and even down census tract and such. So take a look at it. Does age and sex, etc. Very rich data set. We have enormous economic data. You go on the news, Wall Street Journal, whatever. Most of those economic indicators are ones that Census Bureau generates. We just finished our economic census. We do 3 censuses. Decennial census, everybody knows about it. We do economic census of businesses across the country, and we do a census of governments as well. All federal, state, local governments. So rich treasure trove of information on that side. And plus we do another 130 plus surveys. Every day of the year, there's data collection going on. We do the the American Housing Unit Survey, American Household Survey for HUD. We do the National Crime Victimization Study for the Bureau of Justice Statistics, the only survey that measures crimes that aren't reported to the police. So it focuses on victims. And we do countless of others, education studies, et cetera, current population study for, historic unemployment, tracking wages, producer price index, all those stuff. So take a look at that. The real value though, all of it is incredibly rich in value, but some new innovations that we're doing is we're putting all of that data into a huge data lake, combining it and creating new data products. So we have something called the Census Business Builder that it's a data visualization, starts with the US and then dives down into counties, down to the county level. And it allows you to look at both the community characteristics and the characteristics of the businesses that are in there. So if you're planning to put a manufacturing plant, you can look at, what's the labor base? What's the average education of the population there? What's the competition? If you're, doing a retail, what's the customer base? What's the total amount of purchase power of that community? Just really rich information. And there is something that Professor Peacock knows about, the community resilience estimates, which is an amazing data set. Again, visualization that puts together not only our demographic data, that includes risk factors, social determinants of whatever, and along with climate data and data on wildfires, areas of floods, areas where you have storms, hurricanes, and things of that sort. So one can look at for vulnerable populations that may not be as resilient if a natural disaster occurs. So it's really good. FEMA uses it and things of that sort. We did the broadband data visualization to find out where we need to be focusing on providing grants for infrastructure. So lots of stuff like that. I do want to mention that we have a couple of our absolute brilliant experts on population data, demographics, Roberto Ramirez and Brittany Rico. And then we also have data dissemination specialist here. So we can help. And we also have the head of our RDC. Where is she, Karen? Oh, she's in the back. If you want secret data, she's the person. Hey, folks, it's been real. Thank you so much. I really enjoyed this. You guys are amazing. And thanks for participating in my little surveys. So. We are now entering the Ask Me Anything portion of our program.
We've got a couple minutes for questions. If you raise your hand, I'll run over with a mic.
Ask me anything.
It's a great offer. Okay, I'll ask one of the questions that I heard before things got started to get you started. So we have some people in the room who are using census data for local initiatives. And so one of the challenges that presents is that they need to get into fine levels of geography, right? We need to know, should we put a park in this neighborhood? What kind of advice can you give for how you go about getting really geographically specific data, and what you would say to somebody who's saying, we've got policy needs. How do we get the data we need?
Yeah, a couple of things. One is you can always go to census.data.gov. It can be a little gnarly, but all the data is there. And secondly, like I said, we have data dissemination specialists whose job it is to help inform you of exactly the data that is available that will fit your particular needs. We have subject matter experts that get together with data dissemination experts that can do webinars for groups of community organizations who are looking for data. We have something called state data centers, whose job it is to actually put together data for states, but they also serve the public. And we have census information centers that can also be used to tap to get that type of information. Now, we are going around the country to engage with folks like you, with universities, with local communities, community organizations, many of which are savvy about these types of data. And what we are encouraging is that we network together, so that often what the model we want to do is train the trainer. So we can work with a particular community group, and then we can say, look, here's all this great data, and look at this, and here's that, and this can really address your issue. Now pay it forward. So make sure that you spread the love, type of thing. And we're doing the same thing at the same time. The idea is to create the value and show the value proposition of the data, so that folks on the community level then understand how you can make really good data, evidence-based decision-making on, where to put a fire station or a school or a hospital or whatever, or infrastructure, or put in a new plant or manufacturing. So we want to make sure that folks are empowered. And it's through that process that we can then activate and get the local communities to be trusted messengers for all of the surveys that we're always doing. It's really, really hard to get folks to participate, guys. Response rates are only going down, they're not going up. And the value of the data increases the more we can get people to participate. We have other methods and such, but always the best data is data that people provide for themselves. So we're looking to find ways through serving the public, through service to you, through providing data, to then empower you to then work with others as well. Next question.
Got one right here.
Hi, I'm Christina Guzman. I'm a grad student here, but I'm also Associate Director of the Institute for Disaster Resilient Texas. We love your data. I'm actually using your data for both projects, for work and school. So my question, a lot of what we do, since we're a land grant institution, as well as space grant and sea grant, et cetera, is a lot of working directly with the public. So if I were, say, not a person who works with this on a daily basis, say a school teacher or a stay-at-home mom or whatever, would I be able to go to the Census Bureau, look up this data and is there a tool that I can use, something a lot more user-friendly than, say, ArcGIS Pro or Stata or something like that, to be able to understand that data myself?
The quick answer is I think so. We have something called Stats in Schools. We have other programs, but I was going to look to our wonderful data dissemination specialist from Austin, Texas, to see if you could offer a couple of words on that.
So if you're in Texas, we will find you.
Your name, please.
Yeah, my name is Lacey Lofton. So if you guys ever need anything, we also have different people in different states, so we can always connect you with that data. Because we have so many different sources of data and because we have so many different data products, it can be a little overwhelming. So it does depend if you're looking to understand your community, to place a fire station or schools or different things like that. So if you ever get stuck, because there is a lot out there, you can always reach out to us directly. And I have business cards if anybody needs one. Yeah, so our website has all of the data. It's on there. All of the data that we have is on our website, which is data.census.gov is the main one. And then just census.gov has all the links to all the surveys and the products that we have. That being said, there's 130 surveys we're doing all the time. It can be a little confusing which source you want to use. So you can always reach out to us for that. But data.census.gov is definitely our biggest source. And it's actually pretty user-friendly.
We're working on it.
Yeah, we're getting there.
Thank you, Lacey.
I'm afraid with that, we're out of time. So let's give Director Santos a hand. Thank him for joining us. I have two quick announcements. If you need a parking validation, do you have some too, Karen? Okay, Karen in the back has some parking validation. So if you parked and you need a ticket to get out, please see her. And we have a lot of food. So please come take some more food. Take some food home. There's boxes. You can take food with you. We have a lot of food. So please enjoy seconds. And thanks everyone for coming this morning. We really appreciate it.